Hello, my name is Madison Bohlman, and I am presenting my capstone project, Household Food Insecurity and Racial Disparities. What is food insecurity? Food insecurity is defined by the United States Department of Agriculture as having inconsistent access to adequate food because of limited financial and other resources. Approximately 13 million American children and 23 million adults live in food insecure households, affecting nearly 1 in 6 households in the United States. This was just one of many alarming statistics I encountered throughout my research. Although food insecurity rates have varied over the past years, one trend that has continued to persist is the gap in the prevalence of food insecurity between minority and non-minority populations. Throughout history, people of color in the United States have faced inequities, discrimination in education, employment, housing, and healthcare. Marginalized communities face poverty and food insecurity at a much higher rate than their white counterparts due to structural racism. This current study is aimed at examining the relationship between household food insecurity and race and ethnicity in the United States. This study has investigated the distribution of food insecurity within households by race and ethnicity in order to address the existing gaps in literature. This study also aims to understand what household socio-demographic characteristics are associated with food insecurity among a national sample of adults in the United States. In this study, a secondary analysis of the United States National Health and Nutrition Examination Survey data, also known as NHANES, was conducted to examine household food security status by race and ethnicity. For this specific study, NHANES surveys from 2017 and 2018 were merged, which included descriptive data on demographic information, dietary data, and household food security status. The data was analyzed using the SPSS statistical software. Descriptive analysis of food security status measures were performed to estimate prevalence ratios by race and ethnicity. Differences in household characteristics and eating habits within the households between racial and ethnic groups were tested by using a multiple linear regression for continuous variables. A Pearson chi-square test was also used to detect the statistical differences between food security status and race and ethnicity. A chi-square analysis was conducted and the p-value was found at 0.00, which is statistically significant. Therefore, there is a significant association between race and ethnicity and food security status. Kramer's B symmetric measures were also used and the value was 0.216. Therefore, race and ethnicity were found to have a small to moderate effect on food security status. These results suggest that household food security status is not equally distributed across the race and ethnicity categories. In this study, food insecurity rates were found at 32% in non-Hispanic whites, 54% in Hispanics and Mexican Americans, and 46% in non-Hispanic Blacks. Differences were found for food security categories and household eating habits by race and ethnicity. Variables such as household income, household size, and education level showed significant differences by food security status among the racial and ethnic groups. These results showed that compared to food secure adults, marginally food secure and food insecure adults were more likely to be Black or Hispanic, had lower education attainment and family incomes. This table is showing the household food security status by each race and ethnicity in the NHANES participants in the 2017 to 2018 data set. Data from the U.S. Census Bureau and the U.S. Department of Agriculture also shows that the official poverty rate increased from 10.5% to 11.4% in 2020. The overall national statistics, however, had an alarming pattern. In both good economic times and bad, Black and Hispanic families consistently experience crisis-level rates of poverty and food insecurity, especially when compared with their white counterparts. The rates of food insecurity among racial and ethnic minority groups were higher than the U.S. mean rate at 22.5% among Black populations and 18.5% among Hispanic populations. There were, however, limitations in this current study, being missing values in the NHANES dataset for 2017 to 2018 specifically, in the Food Security Questionnaire data, 463 participants had missing values for all of these items in the Food Security Questionnaire section because the family questionnaire was not administered. There is also limited guidance on how to best identify food insecure households for the purpose of advancing prevention research, policy, and intervention. This limits the ability to understand whether strategies identifying participants are equally effective among different subpopulations of people who are food insecure. Results from this study indicate that food security status is significantly lower among minority households. In racial and ethnic group comparisons, Mexican Americans had the highest prevalence of very low food security at 13% compared to the rest of the study population. The study results also suggest that targeted programs are necessary to decrease food insecurity in vulnerable populations and barriers. Accessing existing programs must be investigated. Although significant progress has been made in narrowing the gap in health outcomes, the elimination of disparities in health has yet to be achieved. In order to address persistent racial disparities in food insecurity, food security advocates must examine the potential impact of utilizing approaches that address structural racism and discrimination more broadly. Thank you.